Hello everyone. We know that September is Suicide Prevention Month. So today I'm going to again discuss the same topic. Last time we discussed some warning signs, before a person commits suicide. So please check that video as well because it's really important to understand, the warning signs so that we can prevent the person. And also, in today's video, I'm going to share some, I have made some notes and I'm going to share some very interesting facts and some data about suicide, and that will also actually deepen our understanding about suicide. So first is more than 720,000 people die every year due to suicide. Now this is a global number, and 720,000 is a very big number, and we know now that because of the number that it is a very very worldwide, it's a big concern, and it's very very prevalent. It's far more than we can even imagine. Like I'm very sad to say this, that I personally know a couple of people who have committed suicide. So it's not that, oh, this doesn't happen, it may happen to someone else and something, but it's something that it affects everyone, everyone, because we are part of the society, and if something's happening somewhere, then we are also affected, and somewhere we can also do a lot to prevent it as well. So this is first. Second is suicide is the third leading cause of death amongst um, people age group of 15 to 29-year old. Now 15 to 29 is actually young adult. Now I have already made videos about how to have a good relationship with your young adult children, because now you can understand that these young adults are so prone and so vulnerable. So it's very important to understand that our responsibility, like I have already mentioned before, that it doesn't stop when the children become adult. Our responsibility as a parent and also as a society is to safeguard this age group of people, young adults, because they are very very vulnerable. Now off late, because of a lot of exposure to the outside world, and social media, and all these influences, it has also made the young adults more vulnerable and isolated and lonely, which is also one of the factors why these things take place. And the vulnerability is again, we have to be very mindful that they also need our intervention whenever is needed. But for that we have to first realize this fact, and that's why I'm sharing these facts. So another is very very shocking is global suicide rate is over twice as high amongst men than women. Now this is again, we have to be very very concerned about that mostly we don't discuss about men's mental health. Now I have already made few videos about men's mental health as well, so please go and check, because now it's high time that we take care of men's mental health as well, because they are far more vulnerable than we would even think about. And one of the reasons is, we always tell our boys, when they are little, that boys don't cry, boys, you should be strong, and don't cry like a girl. Many many times, moms say that don't cry like a girl. Now when we say all these things, boys then eventually learn to just shut up, and they just don't share their emotions or their problems. And when it all gets bottled up inside, then there is more chance that they are not going to seek help when they are in trouble, or they have difficulty in sharing their issues, and eventually they take extreme steps. Then that we is very very actually sad. And this is why we have to now be even more careful while raising the boys as well. So don't just think that girls only get affected, but also we have to normalize that boys also can have big emotions, and they also need support and guidance. So that's one of the thing. So yeah, another important point is emotional neglect and emotional abuse are two big contributing factors for suicide risk in adults. So the childhood experience of emotional abuse and emotional neglect. So when a person experiences these two things, especially along with other things as well, but these two were actually the top most risk factor, especially if they have experienced these things in the childhood. So that actually along with another thing is suicide, is sexual abuse, that contributes to the suicidal risk in adults. So now again, it boils down to how we handle our children in the childhood. So many times, emotional blackmailing and emotional manipulations and emotional abuse is very, very common, especially, sometimes even parents unknowingly, or sometimes out of habit, they just inflict those behavior on their children, and they make them very vulnerable, but they don't really realize this, and hence we have to be very mindful. That's why we have to learn about parenting and mindful parenting, and how not to raise children in a way that can be very, very damaging, and be very, very aware, develop this awareness that no, I shouldn't be doing this, and learn about the things that this behavior can be damaging to the children. I have made plenty of videos so about these aspects as well. So it's very important that we learn about parenting and how to raise children, and especially the emotional intelligence in children, because emotional intelligence is really, really important for preventing the mental health issue and the suicide factors. So that's another point, that do not ever treat your children in a way that they feel emotionally abused, and do not neglect them, and teach your children about how to safeguard against the sexual predators. That's a very big topic in itself. I'm going to make separate video on that, how to safeguard the children, including boys. We sometimes feel that sexual abuse happens only with girls and not with boys, but that's not the case nowadays. I have seen a lot of examples that even boys get sexually abused. So these are really important point I wanted to discuss today. And another is that substance abuse are also some of the risk factors, like in adults, and even young children, and adults. Sometimes they get into this drugs and alcohol and all, so that also then make them even more vulnerable for that. Another is social isolation. Sometimes adults, sometimes they live in social isolation due to any reason. That is another contributing factors. So I'm going to discuss some more contributing factors of suicide. So sometimes job and financial issues are one of the leading cause in suicide amongst people, especially men, and relationship issues, and another is serious illness and chronic pain. Now these are really prevalent in older adults, and people who are dealing with depression, schizophrenia, anxiety disorders, or if they have suffered traumatic brain injuries. And those are the thing that can be really difficult to deal with, and hence they then resort to suicide. Another is if they are suffering from back pain, brain injury, cancer, congestive heart failures, COPD, which is a chronic obstructive pulmonary disease, which is a lung issue, epilepsy, AIDS, HIV, migraine, and sleep disorders are also risk factors, along with malignant diseases, which is like cancer and neurological disorders and liver disease and male genital disorders and even arthritis. So now we know all these risk factors and all, and if you think anyone needs your help, support, guidance, then be mindful and provide the help. And that's all I want to share today. So, as a society, we all have to work together, because, as you can see, the numbers are very big, and even the young adults are at risk. So, when we work together and we become more mindful, more aware and open to discuss difficult subjects like suicides and mental health, problems and all, it's only then we can safeguard ourselves, our children, and our society. So, we have to work together. So that's all for today. Until next time, be mindful and happy parenting.